Welcome everyone to day 7 of our 7-day NCLEX Pharmacology training. If you're here for the first time, I welcome you. If you are here for the first time, make sure you have seen day 1, day 2, day 3, day 4, day 5, and day 6 of our 7-day training, because in each one of those days, I have been providing quality strategies, critical thinking, knowledge that is going to be beneficial for your NCLEX success. Also, make sure that you see our other 7-day training, which I provided several months ago, and it's going to help you a lot to prepare the correct way for the NCLEX. The previous 7-day training was mainly about the different categories of the NCLEX and the different style of questions that you could see on the NCLEX. And this 7-day training that you're observing now, it was a pharmacology training. So I hope in God's name, in Jesus' name, that what I provided to you really makes a difference in your success for the NCLEX, in your ability to answer NCLEX style questions. All right? So with no more delays, let's begin. Let's begin today's training, which is going to be about prioritization. So we're going to practice some priority questions together, different scenarios, so you see a different approach. Although we have been practicing prioritization questions throughout the 7-day training. So it's not something completely new. It's something that you have heard and seen already. We're just going to dedicate today's practice questions to prioritization. Okay? And as I promised, today I wanted to give some free access to our membership to a few of you. Okay, and when we get to that part, I want you to understand this very, very clearly of what is my intent, what I want to do. I know that there are people in this training, in this life, that are all over around the world. And for some of you, you cannot even afford to pay a $9.99 membership. And please, I say this with respect, not judging, not making fun of it, because I would never do something like that. But if you are in that scenario, I want to select a few of you and give you free access to our membership, just to help. I know that there's a lot of you, and little bit by little bit, as I do live trainings, I will continue to do this, just to help out the community out there that, for whatever reason, you don't have that amount of money to pay for a mentor, and I want to help you. Okay? So whenever we get to that part, and I say what I'm gonna say at that moment, make sure that only reply those students who are really in need. If you are, let's say, in the US, Canada, in other countries that $9 for you is nothing and you can afford it, leave that spot for somebody else that is in more need. Okay? I say this with humble in my heart, with respect for all of you, but let's make a difference, because sometimes in order to receive, we have to give, and that is what I have learned in the most beautiful book I've ever read in my life, which is the Bible. So you have to give in order to receive. And when you give, don't give it to receive, but it's just an outcome of doing that. Okay? So I hope it helps somebody out there. I hope that I have been a blessing to many of you. And let's begin today's training, day 7, NCLEX Pharmacology, Prioritization style questions. Okay? All right. Suzette, let me help too. I can I can send you for a couple of people too. Wow, Suzette, thank you. Thank you very much. Very, very nice of you. All right, guys. Let's see our first question. Let me. Oh, here it is. I get lost with technology sometimes. All right, here it is. It says the nurse is caring for a patient newly diagnosed with hypertension. So we have an important keyword here that we have to put emphasis on, which is newly diagnosed. It could be important for the scenario, maybe not. I don't know yet. Remember, I'm reading the question. I don't know what keywords are going to be important or not, pertaining to the scenario or not. But the bottom line is that it is an important keyword. And I want you to learn how to do that. Okay? Patient newly diagnosed. Okay? So we're going to circle or underline newly. The diagnosis is hypertension. There has been several blood pressure readings over the past 8 hours. At 8 o'clock in the morning, it was 164 over 93. At 12, it was 158 over 90. At 1600 hours, which is 4 p.m., it was 166 over 94. So as you can see, throughout the day, the patient has been hypertensive. 164, 93, 158, 90, 166 over 94. Okay? So the highest reading was later in the evening at 4 p.m. The healthcare provider prescribed a no added salt diet and plans to start, okay, another keyword here, start the patient in hydrochlorothiazide 25 milligrams. Okay, so the name of the medication is important, the type of the medication, and you tell me. We've been talking for the past 7 days about pharmacology. So what category of medication is hydrochlorothiazide? Because when they're giving you a medication, you have to think, okay, what category of medication that is and what is the effect of the medication. And then he says, what is the most important for the nurse to do before administering this medication? So the intervention that we're finding, the most important one, is before we administer the medication. If you look at the answers, most of the answers seems very interesting. Number one, check the potassium level. Important. Number two, review the patient's urine output for the past 24 hours. So we want to get a baseline of what the output was before starting this medication. Okay? I see that some of you are telling me that the volume is too low. Okay, let me raise it a little bit. Let me know if that's better, if you can hear me better now, or if it's too loud, let me know. So answer number two, assessing the urine output for the past 24 hours is important as well because it gives you a baseline of what the urinary output is in order to compare with the urinary output after beginning of the hydrochlorothiazide. Okay? Answer number four, check whether the patient is having abnormal heart rhythm. And answer number three, that I skipped, instruct the UAP personnel to check the patient's blood pressure. So I see that some of you are answering one, some of you are answering two, I don't see anybody else answering 3 or 4. Okay? So the medication, the first thing that we have to know is that the medication is a diuretic. It's under the category of thiazide diuretic, which is used to treat hypertension. That's why it's giving, they're giving this medication, they're starting this medication for the patient. Answer number 3 and 4, especially 3. I think 3 is the one that we can eliminate the fastest, because it says, tell the UAP to check the patient's blood pressure. Remember that when you're giving a medication, especially for the first time, the nurse needs to do an assessment. He needs to do an assessment of the blood pressure. He needs to do an assessment of a lot of things, and it needs to be done by the nurse. And I understand the UAP helps, that we can use the information provided by the UAP, but whenever it comes to an assessment of a current condition in order to medicate the patient, we have to do the assessment ourselves. So answer number 3, this delegation is inappropriate because we're starting a new medication on a patient that is hypertensive. So answer number 3 is eliminated. I see some selecting now answer number 4. Okay? So let's analyze answer number 4. Check whether the patient is having abnormal heart rhythm. Why are we going to select this answer? And think about it. And I know that when you administer a diuretic, the patient can lose potassium. Remember that there are diuretics, such as thiazides and loop diuretic, that the patient, one of the effects of the medication, the adverse effect, is that it loses potassium. And the patient is at risk of hypokalemia. But remember, it says, check whether the patient is having abnormal heart rhythm. Why are we checking for abnormal heart rhythm? The patient's condition is hypertension. It's not common to see abnormal heart rhythm. But of course, if we're seeing hypokalemia or hyperkalemia, the patient can develop abnormal heart rhythm, but we're not there yet. So answer number 4, I think we can eliminate. It doesn't make much sense. Okay? So answer number 1 and 2. We are left with answer number 1 and 2. What is the most important answer? Well, 2 things going on here. It says 1 is check the patient's serum potassium level. This means check the potassium now, okay, to get a baseline. And answer number 2 says check the patient's urinary output for the past 24 hours. Okay, so we got now or 24 hours. Well, now has priority over 24 hours. And answer number 1, the current potassium level will be extremely important before I start administering diuretics. Because what if the patient is already in hypokalemia? Am I going to be administering a diuretic that loses potassium when a patient is already in hypokalemia? Of course not. So answer number 1 makes sense and deals with the medication. If we are administering a potassium-sparing diuretic such as spironolactone, you also have to be careful with potassium at that time, because now the patient is at risk of hyperkalemia, but still the potassium will be affected. So the correct answer is number 1. This does not mean that answer number 2 is bad. Answer number 2 is a good response, but it's not my priority, because my priority is potassium, because an adverse effect of this medication is to cause hypokalemia. Okay? All right. So let's go to the next scenario. Says the client is admitted to the medical unit with shortness of breath, dyspnea, and respiratory complications. Ding, 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 ding. We got a problem here. We got a respiratory problem. Shortness of breath, dyspnea, and respiratory complications. So I ask you the question, is this an emergency? Is this scenario an emergency? Yes. Yes, it is an emergency. And why do I need to ask this? Well, we're facing a prioritization style question, and we see within the answers that we have a mix of answers that are assessment and implementation. Hear me out, guys. This is important. It doesn't matter if you're selecting the right or the wrong answer. I want you to listen to the analysis. Because if you listen to the analysis, you can apply it to more difficult questions. The most important part of this training is not to know whether you're right or wrong. It's to know if you're right for the right reason or if you're wrong for the wrong reason, of course. Okay? So the first thing that we got to know that this is a prioritization question. We know that this is an emergency, and we have a mixture of answers that are assessment and implementation. Answer number 1 is implementation. Answer number 2 is implementation. Answer number 3 is assessment, and answer number 4 is assessment. Why is this question that I'm asking so important? Okay? 1 second. Okay, perfect. So why is this analysis so important? Because once you have determined that you're dealing with a prioritization question and you can use a strategy, it will be much easier to respond. So now I say, okay, I'm facing an emergency. I know that there is a mixture of assessment versus implementation. The strategy that I know says that if you have a scenario that is an emergency and you have a mixture of assessment and implementation answers, in most of the cases, your answer will be an implementation. Therefore, answer number 3 and answer number 4 we can eliminate. Now, is answer number 3 and 4 a bad answer? Absolutely not. Assessing the patient's lung sounds is important. Answer number 4, obtaining a pulse oximetry reading is important because it helps me validate the subjective data that I have on the stem of the question. But because it is an emergency, I have to implement. I have to do something. If your patient is in distress, do not assess in most of the cases. So assessment is eliminated. I have 1 and 2 as implementations. And we have seen many times that oxygen is the answer. We've seen several times during this 7-day training where oxygen has been the answer. So the question is oxygen the answer again here? Are we going to prioritize oxygen over elevating the head of the bed? And the answer is no. The correct answer is 1, not 2. But why? Why is oxygen not the answer now? The patient is in dyspnea and respiratory distress. Elevating the head of the bed helps with the lung expansion. It helps to provide more capacity of those lungs to receive the oxygen. Now, is this going to fix the problem? Maybe not, but it will help. But also, it is the fastest action that I can do to help. But if we go to Maslow, elevating the head of the bed also helps with airway, lung expansion, more airway coming in. And oxygen deals with breathing. So if we use Maslow here as well, we know that airway has priority over breathing. So the correct answer will be 1. There's another strategy that you can think of here. Whenever you see one of the answers that says change the position, go to standing, sitting, left lateral, right lateral, whatever the position change is, whenever you see that as an answer on an NCLEX style question, ask why. Why am I going to change the position? And if that position helps with this scenario, it could probably be the correct answer. So that is another strategy that you can think of as well. Okay? So we've seen so far, we've seen a prioritization question where you can apply the assessment versus implementation strategy. Now we're going to see a different style of question. And this is probably one of the most difficult questions that you will encounter on the NCLEX. Now, this scenario that I'm going to put for you is not too difficult, but I want you to understand the concept, grasp the concept. Why is this the most difficult type of question that you could see on the NCLEX? Usually, they give you 4 patients with 4 different conditions, and you have to identify which patient is more unstable. They can also use this style of question for pharmacology prioritization. So they can tell you there's 4 patients with 4 different conditions, 4 different medications to administer. What medication are you going to administer first? So in this scenario, we have a patient with heart failure who has 2+ edema. And the answer number 1 calls for the administration of digoxin, which you know, you've learned already. Plus, it's telling you here that is a cardiac glycoside. Answer number 2, a sliding scale of insulin to a client with a fasting blood glucose of 200 and demanding breakfast. So this patient wants to eat, has a blood glucose of 200 and has a sliding scale insulin to be administered. What an interesting scenario. Answer number 3, a loop diuretic furosemide to a client with a 24-hour intake of 986 and an output of 1,400. So now you even got to do math on this question. And you have to know how to calculate fluid balance. Remember, you do fluid balance by taking the input and output and subtracting it. If you have plus 500 or negative 500 or more, it calls for a doctor. You have to call a doctor. So whenever you have a negative or positive balance of more or negative 500, you have to call the doctor. But in this scenario, yes, we have a difference. Only came in 986 and went out 1,400. So we have a negative balance, but it's not negative 500 yet. It's almost there, but it's not there yet. That is important because that tells you that the problem is not even sufficient in order to call the doctor, because you call the doctor after you have negative 500 or positive 500. So I think answer number 3 we can eliminate. Answer number 4, the ARP remember that ARB is angiotensin receptor blocker medication to a client whose blood pressure was reported by the UAP of 142/76. So this patient, 142 is a little bit more towards the high range, but not significant to think of a priority in answer number 4. So we can eliminate. We are stuck in between 1 and 2. Either we give first digoxin for a patient with heart failure and a 2+ edema, which is chronic, expected, or we see a patient with a blood glucose of 200. Although 200 is not a super critical lab value, it's still abnormal. Because what is the range? Some books say 70 to 110. I've seen some books saying 70 to 120, around that range. But we have 200. We have almost twice the normal limit, or the higher normal limit. So whenever you see a critical lab value, okay, you have to really prioritize those scenarios. But there's another important concept in answer number 2, that it is not in answer number 1, it is not in answer number 3, and it is not in answer number 4. The sliding scale insulin and the patient not having breakfast, there is a time situation here. This medication needs to be administered within certain time of the breakfast. Some medications, some insulins have to be administered before. Some insulin have to be administered exactly with the food tray there in order for the patient to eat, to prevent the risk of hypoglycemia. So answer number 2, there are several factors in answer number 2 that we prioritize. The first factor, insulin and high-risk medication. Second factor, we have an abnormal lab value, 200 milligrams per deciliter of fasting blood glucose. And third is a time-restrained medication. It cannot be just administered whenever. It has to be administered at the time of breakfast, lunch, and dinner. So several things going on with answer number 2 that makes you selected as the correct answer. Okay? Now, what about answer number 4, Professor? Because, I mean, it has a 2+ edema on the feet. And yes, this patient is retaining fluids, but the patient has heart failure. This can be seen in heart failure. It's not indicating a very critical scenario. And this is a medication that is not as time restrained as the one with the insulin because of the breakfast. Okay? So we prioritize answer number 2. Let's do this question. Which priority intervention should the nurse implement when administering a loop diuretic? Remember, we talked about this diuretic to a client diagnosed with coronary artery disease. What are you going to assess? Are you going to assess apical pulse? Are you going to assess the serum potassium level? Are you going to assess the glucose? Or are you going to assess the pulse oximetry reading? So we have 4 assessments. We have to determine what is the priority assessment and which assessment is more pertaining to the medication. Loop diuretic. Remember, this patient loses potassium, is at risk of hypokalemia. We already seen this in another question. This is just a little bit different, but it's still the same concept. Okay? So if you know that the diuretic, the effect that it's going to be, which is to increase the urinary output, And in the increase of the urinary output is going to lose electrolytes such as potassium. That helps you remember that you have to assess the potassium level. Plus is the one that will cause the greatest significant effect on the heart. Apical pulse, answer number 1. Okay? Yes, you check apical pulse with some medications. We talked about digoxin, we talked about calcium channel blockers. There are certain medications that you have to check the apical pulse before you administer, because if it is below 60, you don't administer. But loop diuretic is not one of them, so we don't need to assess the apical pulse. Number 3, assess the glucometer reading. Okay, first, they don't describe the patient as being a diabetic patient. Okay, and the loop diuretic is not going to cause a significant effect on the glucose. So answer number 3 we can eliminate. Answer number 4, assess the client's pulse oximeter reading. Well, they're not describing the patient as a patient with a respiratory problem, difficulty breathing, hypoxemia. There's none of that going on in this scenario. So we can eliminate 4. It does not relate to the stem of the question or the medication. So the correct answer is the serum potassium. Okay? So let's go to the next prioritization question. And notice an important keyword here. Okay? It says, the nurse is administering morning medications to a client on a telemetry unit. Which medication will the nurse question? Keyword. Which medication will the nurse question? So we do not want to administer that medication. We are not looking the medication that we are administering. That will be a different style of question. We're looking for the medication that we do not want to administer. One says furosemide. Furosemide intravenous push to a client with a potassium level of 3.6. Potassium level is normal. Normal is 3.5 to 5.0. So 3.6 is normal. We don't have to question the administration of furosemide with potassium. Notice, once again, they're questioning the use of diuretics and potassium levels. So if you didn't get the message, I tell you out loud. It's important. So we are not going to question 1. Digoxin to a patient with rapid atrial fibrillation. We are not going to discuss this. We're not going to question it because digoxin, this glycoside, cardiac glycoside, is the appropriate medication for a atrial fibrillation with a rapid ventricular response. 2, eliminated. Enalapril, notice the ending of pril. This is an ACE inhibitor. ACE inhibitor to a patient whose blood pressure is 86/64. This patient is hypotensive. If the blood pressure is below 90 systolic, we cannot administer a medication that will decrease the blood pressure. So answer number 3 looks like the answer. Answer number 4, administer morphine intravenous push to a client complaining of chest pain who is diaphoretic. Clinical manifestation of a possible MI. Remember the medications that we administer: morphine, oxygen, nitroglycerin, and aspirin. So answer number 4, we do not have to question. The correct answer is number 3. Now, let me show you the dangerous things in the NCLEX. This is why NCLEX is so difficult. Okay? I'm going to put a scenario that is the same thing. All the answers are the same, but something changed in the stem of the question. And the only thing that I'm going to change is, instead of putting which medication would the nurse question, I'm going to put which medication would the nurse administer first. So now the question changed completely. But isn't this magical? That you change one word and it changes the whole scenario. And it's a totally different response. Now, the answer is not 3, because answer 3, we're not going to administer. We're not going to administer enalapril in a blood pressure of 86/64. Answer number 1, we can eliminate because the patient is stable. So now we're deciding between 2 and 4. But you remember how the previous scenario, we eliminated answer 2 and 4, and we selected answer 3. But now we eliminated answer 3, and now we're debating between 2 and 4. Because I'll tell you something, they both need help quickly. But which one is going to be the priority? Answer number 4 is giving clinical manifestation of a possible myocardial infarction. Myocardial infarction has the priority over atrial fibrillation. So the priority medication to administer is 4, not 2. It's the morphine, the one that has a priority. We can see digoxin and atrial fibrillation later on. But you see how a simple word changed the whole scenario. That is how prioritization works. And this is why I encourage each one of you to read the question slowly and putting emphasis on the keywords and the details inside the question. Because if you just overread, you're going to make a lot of mistakes. If you don't learn anything from our 7-day training, learn this at least. You have to read the questions slowly. You have to develop the ability to read the question properly and identify the key words on the NCLEX style question in order to prevent making serious mistakes. Okay? God bless you, family. I wish you the best. Let's go for that NCLEX. 2022 is the year to become a registered nurse. God bless you.